Hello, I'm Raji Anand from the Institute for Population Health, or IPH, at Weill Cornell Medicine-Qatar. Recently, IPH published a research paper focusing on the status of physical activity and sedentary behavior in the Middle East and North Africa region. The paper has been published in Scientific Reports, an open access journal belonging to the prestigious Nature group of publications. Today, we are in conversation with the authors of the paper, Dr. Ravinder Mamtani, WCMQ's Professor of Population Health Sciences, Professor of Medicine, and Vice Dean for Student Affairs Admissions, Population Health, and Lifestyle Medicine, Dr. Sonia Shaban, Project Specialist, Dr. Karima Shabna, Population Health and Communications Specialist and Instructor in Population Health Sciences, Dr. Amit Abraham, Instructor in Population Health Sciences and Project Specialist, and Dr. Sohaila Chima, Director IPH and Assistant Professor of Population Health Sciences. Welcome. Dr. Mamtani, if I may start with you, why did you feel this research topic was important and relevant?
Good morning, Raji. Chronic, also called non-communicable diseases, such as heart disease, stroke, obesity, and diabetes account for about 40 million deaths worldwide on an annual basis. That translates into approximately 70% of all deaths. And not surprisingly, a lot of money goes into managing, as we know, and treating these problems and other debilitating conditions such as chronic pain, anxiety, and depression. These numbers and statistics beg an important question. What causes these chronic conditions? Research has confirmed that lack of physical activity and other unhealthy habits and behavior, such as smoking and poor diet, cause most chronic conditions and premature deaths and also impair quality of life. If we now turn our attention to the Middle Eastern region, we know that the prevalence of many chronic conditions such as diabetes, heart disease, and obesity is quite high. And all of these conditions, I should hasten to add, are linked, absolutely no doubt, to low levels of physical activity and sedentary behavior. So then it becomes important that we understand patterns of physical activity and sedentary behavior in this region. With that in mind, we decided to pursue our interest in synthesizing data and evidence on the subject of physical activity in the Middle Eastern region.
Thank you, Dr. Mamtani. Dr. Shaban, you're the first author of this paper. Can you please tell us what is the aim of the study, the objectives?
Thank you, Raji. The aim of our research study was to synthesize the evidence on physical activity and sedentary behavior among the youth and adults in the Middle East and North Africa region. The 20 MENA countries included in the study are Algeria, Bahrain, Djibouti, Egypt, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, Oman, Pakistan, Palestine, Qatar, Saudi Arabia, Sudan, Syria, Tunisia, the United Arab Emirates, and Yemen.
So let's hear how the study was conducted. Dr. Abraham, if I may invite you to respond.
Thank you, Raji. So we use several databases to conduct a comprehensive search of the available literature on physical activity and sedentary behavior. We statistically combined available prevalence data on physical activity from the retrieved studies. Our overview included 7 systematic reviews and 229 primary studies. Our combined analysis included 125 prevalence measures from 20 countries in the Middle East and North Africa region.
Thank you, Dr. Abraham. Dr. Shaban, if I can come back to you, can you please summarize the main results of the paper for us?
Thank you, Raji. We know that the WHO recommends 150 minutes of moderate physical activity per week for adults and 60 minutes of moderate to vigorous intensity physical activity daily for children and youth. In the Middle East and North Africa region, we estimate that about 49% of adults and 75% of youth population were not sufficiently active as per the international guidelines for physical activity. Our findings are similar to the global estimates of insufficient physical activity. Our results also suggest a lower participation in physical activity by the youth in comparison to adults in the region. Additionally, more males engage in sufficient levels of physical activity compared to females. However, these age and sex differences that we observed in the region are also found in several countries globally. Now, whether sedentary behavior is a public health issue in the MENA region remains unclear due to the absence of clear, standardized definition and measurement guidelines to quantify and interpret it.
Interesting. Along the same lines, were there any specific findings for Qatar? Is Qatar any different from other countries, for example, the Gulf Cooperation Council countries, or even globally?
Similar to other GCC countries and globally, nearly 51% of Qatari adults are not sufficiently active as per the international guidelines for physical activity. Also, comparable to global estimates, 85% of Qatari youth are not sufficiently active as per the international guidelines for physical activity. For youth, this finding is among the lowest in the GCC.
Thank you, Dr. Shaban. Dr. Shabna, if I could bring you in, what are the barriers to physical activity in the region?
Thank you, Raji. Actually, the barriers vary among the high income and the low and middle income countries of the region. Some barriers to physical activity that were identified in our study include deficiencies in the built environment, like lack of parks and sports venues, rapid urbanization with access to motorization, hot arid climate, the employment of domestic helpers, lifestyle factors like high screen time and poor sleep habits, absence of social support from friends and peers, and the social cultural role of men and women in the region.
Thank you, Dr. Shabna. Dr. Chima, if I can bring you in, could you please let us know if the study identified any research gaps pertaining to physical activity for the region?
Thank you, Raji, for that question. We actually identified several research gaps. Firstly, that there is a need to conduct large and up-to-date country-level studies using standardized tools and definitions to quantify physical activity participation and sedentary behavior. Secondly, we also need to further understand the personal, the social, the environmental barriers to physical activity, particularly in relation to the different domains of physical activity, like leisure time, households, physical activity, which is specific to the region. So then we can facilitate effective, locally informed interventions. Thirdly, additional studies considering demographic specificities in the Gulf Cooperation Council are needed to provide evidence on physical activity behavior to develop, implement, and monitor public health programs.
Dr. Chima, if I may continue with you, are there any specific recommendations pertaining to physical activity for the region which the authors are proposing?
Raji, you ask a very important question. Yes, we make several recommendations in the paper. Firstly, the implementation of locally informed, evidence-based interventions promoting physical activity participation at the standardized recommended levels. Addressing barriers for physical activity would be a step in the right direction. Also, the female youth should be a target population for future interventions to increase physical activity participation in the region. Furthermore, one of the most pressing needs to improve population health is to develop appropriate policies and implement interventions to address the global pandemic of physical inactivity and sedentary behavior.
Thank you, Dr. Chima. So what does the study add to the published literature? Dr. Shabna, if I may address the question to you.
Yes, Raji. To our knowledge, this is the most comprehensive systematic overview and meta-analysis covering several dimensions of physical activity behavior in the MENA region. Our overview is the first to bring together the available evidence on sedentary behavior and physical activity. This compilation will serve as a benchmark for epidemiologists and public health interventionists.
Very commendable. Dr. Abraham, if I may bring you in, could you please talk about the limitations of this study?
Certainly, Raji. So the data that we used on physical activity and sedentary behavior was actually collected prior to 2018. So new data on physical activity from the MENA countries may have been published since. More recent data would provide indication of an increased participation in physical activity amongst adults. That said, time trends and patterns need to be confirmed in future investigations.
Thank you, Dr. Abraham. Dr. Mamtani, if I may invite you to make some concluding remarks.
Raji, a great question. It's great because it's an open-ended question, and I'm happy to respond to it. Well, as we've learned from the remarks that have been made, clearly this study has made major contributions to our understanding of physical activity in the region. Clearly, promoting physical activity and limiting sedentary behavior should be health priorities, both for adults and for children. This will help reduce overall burden of disease and other conditions such as obesity and diabetes and so on and so forth. Incorporating physical activity in our daily routine and in our lives is vitally important. This is true, especially when you couple this with eating healthy plant-based diet, smoking cessation, managing stress, and harnessing the benefits of social relationships, all of which can be extremely helpful in reducing premature mortality and even reversing, as we now understand, chronic conditions such as diabetes and heart disease. The evidence concerning the health benefits of physical activity is ample. We at the Institute for Population Health at Cornell in Qatar are at the forefront of supporting the state of Qatar in promoting its overall goal of healthy lifestyles. Thank you.
So thank you all. It was an excellent conversation on the significance of physical activity and sedentary behavior in the MENA region. If you have any comments or suggestions, do write to us at iph@qatar-med.cornell.edu and stay tuned for our next episode. Connect with us on social media, #IPHQatar. IPH, paving the way to population health.